more than 290 Kenyans have lost their lives, with more than 60 health facilities in 11 counties affected by floods. In a press statement, government spokesperson Dr. Mwaura said the government is working around the clock to ensure the safety of Kenyans, with multi-agency teams working to ensure repairs of the affected infrastructures in the country.
According to the report by the government spokesperson, this week the most affected areas by floods include Tana River, Garissa, Lamu and Narok counties.
The damage that these floods have caused in terms of our infrastructure is up to 80 billion. And that could only be mostly on roads alone.
Speaking to the media at Nyayo House, Nairobi, Dr. Mwaura said the government continues to provide food and non-food items to the affected areas in Busia, Homa Bay, Kisumu, Machakos, Makueni, Tana River, Kilifi, Nakuru, Turkana, Isiolo, Migori, Kajiado, Nairobi, Nyandarua, Kiambu and Murang'a counties.
Food is still being distributed. There is, however, need for more food, medical kits, non-food items to affected counties, and where search and rescue operations are still ongoing, including Narok, West Pokot, Nyeri, Siaya and Kenyaga counties.
The Kenya Defence Forces are actively engaged in the Nakuru County with efforts to clear the roads to ease traffic flow ongoing following the mudslides that left death and destruction.
Till we have the KDF members in Mahiu, 151 of them. The search and rescue is still going on. Remember, of the unaccounted for people, Mahiu is still, leading, and it's quite something.
The government, through the State Department for Public, is undertaking demolition and unsafe structures in Kirinyaga, Kiambu and Nairobi counties following reports that human activities have obstructed the waterways and altered the courses of the rivers.
Accordingly, all persons residing within the 30-meter riparian corridor of rivers and other water courses across the country, especially here in Nairobi, the rivers of Nairobi, Ngong and Mathare are the most affected, have been ordered to vacate for their safety. Mandatory evacuation along rivers in Nairobi counties, again Mathare, Ngong and Nairobi, is also ongoing, with the government facilitating logistical support, temporary accommodation and essential supplies to those affected.
Over 50 cases of cholera have been reported so far, with the Ministry of Health in collaboration with the Kenya Red Cross conducting medical outreach programs for cholera control and other waterborne diseases in Tana River and Marsabit counties. Reporting for the Muslim Insight, my name is Naima Juma.